But thank you very much to both of you, because I think that set the scene, and both sessions have really illustrated the practical things that practitioners are doing, and the people who are involved in infant feeding are setting up and supporting, even to the extent of thinking of the next stage of gathering up research to help future mums. And I guess this is all going on at the moment for you, Amy, as you're going. Getting all that. Now, the reason I'm glancing down, because I have the next task I have to do is to throw questions at you, because people, oh my goodness, people have been sending in some questions tonight. Okay, and the first person is a lady called Karina Marius, and she's saying, is the infant feeding resources available in other languages? I guess that might be for Francesca, with the Unicef materials.
The specific ones we've done for coronavirus aren't available in different languages at the moment, but we do have a set of core information leaflets in other languages on the website, if that's helpful to her.
Okay. And would you have, because Unicef is Unicef, yes, I guess that you would be able to link up with other countries who have resources in different languages focusing on COVID?
There is a global UNICEF website which has a Q&A on infant feeding.
Okay,
so
Karina
ours is very much UNICEF UK. If anybody wanted to ask any questions specifically to Baby Friendly, we do have a email address which I could inquiries at UNICEF UK Baby Friendly, which I'll send. Okay. I'll send you the link soon.
Okay, we'll put that on the resources sheet afterwards. Yeah. Thank you very much. Okay, the next question is from Marjorie Asani, and she's saying, we are supporting more over video calls. What does everyone do about finding ways to communicate with non-English speakers, or I guess women who for English isn't their first language, I guess, too?
I know from the infant feeding leads in some of the areas, the infant feeding network leads across the UK that I was talking to today, there are populations obviously where there are a lot of non-speaking mothers, and I think if they contacted their local infant feeding lead, there would be access to translators probably, and they'll find out what's available locally. Quite often those services are very good. And particularly in this environment, you can have a translator in a three-way. I mean, there's always a situation where if a mother really needed a face-to-face contact, the midwife would arrange that. You know, in whatever situation that would be, if there was a safety issue or a safeguarding issue or anything else, anybody doing that telephone conversation would find that isn't the appropriate way and would find a way that if there was a need to do that.
That's great. Thank you very much, Francesca. Okay. Now we've got Charlotte Ann is asking, initiation rates are often as a result of face-to-face support in postnatal weeks, whilst breastfeeding, expressing, etc. Do we think in the long term, as a result of peer supports and midwives having to do telephone contact, we'll see a drop in continuation rates? That might be to Amy.
Again, I really am not sure on that one. I think we might see that mixed bag in that a lot of women are very, very determined, and a lot of breastfeeding supporters and midwives are very, very determined as well. I think it's really important that we've completely recognised that this is a major issue, and that so many resources have been developed for that. Really, as I said, I think it could go either way, in that some women will have the resource and support and context of their personal lives to be able to be kind of benefiting from this. Others, they're going to find it much more difficult, and it will be interesting is really the wrong word here, but it'll be very interesting to see how it all plays out. And I think we're going to learn a lot of lessons about the benefits and disadvantages of online support, because one of the positive things coming out of this is we've learned that it can help at least some women. So how do we keep that going so that we've always got that kind of backup or different option for them if that's what they prefer or find easier?
So you're thinking, so it's looking as though online and Zoom and Skype and all the online things that we've been doing over the last few weeks might be one of the things that we really keep.
Yes.
Not for every woman, but maybe for those group of women who it might suit.
Yeah, certainly I wouldn't want to see it instead of face-to-face, because face-to-face is so important for so many reasons, isn't it? You know, body language, just that contact with someone and them being there. But certainly there are certain strengths to online stuff that we would like to keep. But I think it's really important that when we can get the face-to-face back, we get it back.
I think about the data, Sue. We haven't been great at data in this country, and the infant feeding survey was last carried out in 2010. So it's a long time since we had UK-wide data. And prior to the coronavirus, the government had promised that we would have some sort of survey in the next 2 years, and they were just starting to plan it. So I think there's a big need to know what's going on around infant feeding, and there's an opportunity there for Public Health England and NHS England and Scotland and Wales and Northern Ireland to get together now to pull some data after this about how women are feeding in general, but also how COVID has impacted on that, and that we all continue to collect the data that we can. It's a really, really good point, and it needs capturing in a meaningful way and not just anecdotally, I think.
Yeah.
I think this looks like a sort of priority piece of research to me.
It does. Yeah, it does.
Okay, and now I've got Jane Marshall is saying, we have just started an infant feeding cafe for the local community to access on university premises, but as the campus has been closed since March, this has sadly come to a halt for the time being. And she says, any advice on how these could continue remotely?
I think there are lots of great examples out there that if you look at some of what the breastfeeding organisations have been doing and the charities and the peer supporters, maybe have a chat to them and see what their lessons learned have been. We've seen online support. You can have a Zoom meeting as such that's a breastfeeding support group where everybody comes along with their baby while sat on the sofa and your cup of tea.
I think as well, aren't the NCT doing a pilot study with the at the moment as well on contacting parents together in this crisis? I think so. I think there's some work going on with the NCT.
Okay, it's keeping a track of all these different things going on. I think because as a midwife, you kind of need to know locally what there is and what you can guide women to. And I guess one of the difficulties is actually knowing. Like when you're raising that, Francesca, whether it's a local or a national thing and whether you can plug into it easily.
I think what's been really impressive through both the mother support groups and the local infant feeding leads is that they pulled together and they're working together to provide resources on there. So if you went on to, say, I don't know, Chelsea and Westminster Hospital maternity site, for example, you'd find access to all the local resources that are there for them. And so if you're a mother, I would say go to your local resource, look on the local website that is linked to your maternity service. And I know that the local infant feeding leads have been working across their services with local authorities, with health visitors and with the peer support groups and mother-to-mother support groups to pull that information together. And the breastfeeding network as well, ABM, Association of Breastfeeding Mothers, they've all got great resources online and directing people to those.
Fabulous. Thank you very much. I'm going to have a practical question now from Susan Vining. She says, why are mums advised to wear masks to breastfeed but not to formula feed? Both hold the baby near and breathe on them. This is at my local maternity unit.
That's a very good question.
Isn't it?
It is. I think the WHO guidance is, I think there's a difference between a mother who's COVID positive and a mother who is just under the normal care of the maternity system. I know the RCOG and the RCM have put out clear guidance on use of PPE by healthcare workers when the mother is in the unit. If a mother is COVID positive and she's formula feeding, somebody else can do it, who isn't COVID positive, of course. However, we know that coronavirus isn't transferred in breast milk, and we want women to breastfeed. So if she has respiratory symptoms, we want her to practice respiratory hygiene when she's caring for her baby. And that would be the same for any mother, irrespective of their feeding type. So, but if she's breastfeeding and she's coughing, we know that the droplets from the cough would spread to the baby's respiratory system. So we want respiratory hygiene. And so they need a mask that is non-penetrable to liquids for her to wear in that when she's actually active with COVID symptoms. So it's about having common sense around changing a baby's nappy if you're coughing and you're COVID positive and you're isolating together at home, or likelihood somebody else in the family has got it as well, maybe the partner. So it's everybody. It's respiratory hygiene for COVID positive, suspected or COVID positive parents.
So actually it's not to do with the type of feeding at all, it's to do with the condition of the mother.
It's to do with respiratory hygiene.
Yeah. And it may be that the unit hasn't kind of caught up with that guideline.
Yeah.
And I think the difficulty at the moment is there's a lot of guidelines coming out. You need to always, and this is for our audience, really check the date of the guideline you're using, because some guidelines are changing very quickly. Just check. And it might be that one's old.
Yeah. And there's some excellent stuff from the WHO on, and it is like you say, so it is difficult keeping up with it all. And always remember to put a common sense hat on it and think, actually, if I was the mother, what would be the best thing for me and the baby? And changing a nappy isn't any different, is it? And coughing over it to feeding it and coughing over it. So
I like this common sense hat. This is nice. I like this.
More of those, please.
And someone has asked, Esther Tiley has asked a very similar question, which I think we've answered really. There's quite a long question. I don't know if we've got time for this one. Susan Vining again. Hi there. Question for anyone. On Facebook at the beginning of the lockdown, women were worried about the problem of finding formula milk, which I think Amy talked about earlier, which is now resolved. But at the time, a couple of mums were offering to pump off breast milk and deliver to the new mums. There were no treatments to the milk, just given straight to the new mums. I suggested this wasn't the safest thing to do, as who knew what the mums were passing in their milk. However, a local doula and very well-known person shared a Facebook page where this is a common practice. What are your thoughts?
I think that's quite a complicated one in the amount of time we've got left. Maybe that's more of a discussion that we could have on the Facebook page, bringing in some links.
Maybe.
I think it's quite tricky and could be misconstrued in any direction.
Yeah,
I could say though, originally the global guidance that came out from China showed that in their flow charts, at the end of it was the best thing for a baby is breast milk. The second best thing is donor milk. And in some countries, wet nursing may be the most appropriate thing to do. In the UK, we have a very good milk banking system. It's not equitous across the country always, but where it's available, and there are lots of really good milk banks across the country, we know that pasteurisation process is robust, it's covered by NICE guidance, and it's best to go to your local donor milk bank and access donor milk, or look at Heart's Milk Bank as well. And we know that it's not just coronavirus that's transferred in breast milk, so there's good screening processes in the UK.
So this suggests this questioner was maybe reading something that was on international Facebook, because our bank milk is pasteurised, and this obviously was either bypassing the system, which is unlikely here, I would have thought, or in a different country.
Yeah, in this country we have a good system guided by NICE and by the EU Human Milk Banking Association guidelines, and we don't need to do that here.
No.
Donor breast milk is a really good. Should be our best option if we can't have the mother's own milk.
Okay, there's several questions actually that have been answered already, like where the central point of getting information, which we've dealt with. And the last one, I think, because we are running short of time now, is from Marika Shaw, saying deprived areas and video calls, Zoom chats, not that compatible. Is there a way around this? Are these mothers our forgotten ones? Which we've kind of talked about a little bit. I don't know if you wanted to add anything else.
The only thing quickly, I don't know if Amy wants to say anything, but the NHS is being funded by their own governments in the nations to provide Attend Anywhere and lots of platforms that are secure, that are linked to the hospital systems. And so you will find a variety, but there are some very, the NHS is catching up on all this and providing some very good systems for the midwives to have secure virtual conversations with the women. And a telephone conversation can be very good too. Doesn't have to be a video.
Yeah. And just to kind of add to that, I mean, that's the sort of thing that we want to be researching of what are the challenges and are there any innovative ways around it? Because how much, if we had the infrastructure there and it was just an issue of women and families not being able to afford high-speed internet, how much would it cost to provide them with high-speed internet to be able to do that? It's not going to be much per family, and it could bring real savings in terms of that family's health, well-being, supporting them to breastfeed their baby if they want to. So that's the sort of thing that I'm thinking about when I'm thinking about what might the solutions be to try and reduce these inequalities. If free internet helps, give them free internet.
There have been some lovely stories, haven't there, in COVID about people who are COVID positive being provided with video phones and video resources.
Absolutely.
So.
Well, I think as always, I could talk and listen to you guys forever, and it's been really interesting. We've had some fantastic questions, so thank you very much to everyone in the audience for asking the questions. We will be on Facebook for a while, so we'll try and answer some of the questions. But I think even if your specific question hasn't been answered, I think most of the topics have been taken care of. I'd just like to thank Matflix and who support the video content from Maternity Experts for this hour, and our partners, the Practicing Midwife Journal and All for Maternity, for their online resources, which also I've put on the resources list for later. I'd love to thank Francesca and Amy for a fantastic presentation and answering a lovely assortment of questions beautifully, and giving us lots of food for thought and highlighting the really important things that we need to think about as midwives and those supporting mums and their babies. So thank you very, very much. There will be resources available on the website later. Next week, we're going to be looking at preeclampsia and preventing preeclampsia as it's World Preeclampsia Day on the 22nd of May. And we've got Professor Andy Shannon joining us next week. And in the meantime, I'd just like to say, stay safe and well, look after yourselves and look after your loved ones, and we'll see you next Wednesday at 7. Take care.
Thank you.
The Maternity and Midwifery Forum brings you Netflix, video streaming from Maternity Experts. All your CPD and revalidation needs met in one place. Our expertly curated box sets are the perfect way to engage with the latest thinking, issue by issue. They make revalidation easy and are the perfect accompaniment to any project or university coursework. In addition to video from expert speakers across maternity and midwifery, there is easily accessible research and links to the latest government policy documents. Our reflective questions at the end are the perfect primer for your revalidation. In the same way the Maternity and Midwifery Forum provides certificates to show that you have attended these festivals, we can provide certificates for those who have consumed the content of a box set and submitted their written answers to the reflective questions provided by our curator, Dr. Jenny Hall. Midwives, maternity professionals and students, do not miss out. Subscribe to Matflix today. Box sets are £17.50 each, or access to them all starts at £6.99 per month. Students, pay just $2.99 a month. Check out the box sets and subscribe today at www.matflix.co.uk.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.